Okay.
Thank you so much for joining us again. We're so excited to have you. Can you go ahead and give us a brief introduction?
Okay. My name's Barbara Gaither, and I am a nurse. I'm a registered nurse. I've been in the nursing profession for almost 40 years.
Oh, wow.
Yeah, makes me
Congratulations.
feel really old.
Perfect. And where are you currently?
I work at Columbus Technical College. I've been here for the past about 21 years, working in health science and nursing.
Perfect. So you're an instructor or program director?
I'm a little bit of everything, and I've done a little bit of everything. Right now, my title is clinical lab manager and also advisor for the students that are wanting to come into our programs. So as the lab manager, we have a lot of high-tech simulation that are the second floor of our building looks like a hospital. And I kind of manage that and make sure those spaces are kept up and that we have the technology we need and that it's working. And then I manage the calendar for that and all the supplies and equipment. So
That sounds so cool.
yeah, it's kind of fun.
Awesome. So what type of education or training is required for your career?
So nursing has lots of different levels, and it's confusing to people that aren't in the field. I actually started out as an LPN, which is a diploma program that generally takes about a year to do. I did that because at the time I had been in school as a business major and didn't want to do nursing. My mom was a nurse. I didn't want anything to do with it, but I was in college and kind of feeling lost, not sure what I was going to do. So I thought, well, I'll give this LPN thing a try. It'll only be a year. If I hate it, what have I lost? And so once I got into it, it just became very obvious that it was my passion. It was where I was supposed to be. So I went on to get my RN, which took an additional year and a half or so. And that basically qualifies me for what I'm doing now. That's an associate's degree. And there's a lot of jobs in the market for just an associate's degree in nursing, which you can do in about 2 years or less. But I did go on to get a bachelor's degree after that, just because that was just for self-fulfillment, really. But my job doesn't require more than just the RN.
Perfect. So thank you for walking us through that, because we've been talking about like associate degrees, a bachelor's, and like certificates and all that stuff. So thank you for saying that. Where did you go for your education and training?
I did my LPN training here at Columbus Technical College. I did my RN at CVCC, and then I got my bachelor's at Columbus State. I also spent a little time at Auburn, so I've just taking advantage of all the local and regional schools that I could.
Yes, that's perfect. That's what I was just thinking. Homegrown. I love it.
That's right. That's right.
Exactly. So you talked about switching over and everything, but what led you to this career? I know you briefly talked about it, but what else led you?
Yeah. I had watched my mom as a nurse and watched her do different things. And I saw that there was flexibility in the career. Like when we were little children, she didn't work very much, and she worked during the night when we were sleeping. So we always had our mom at home. So there was that nice flexibility. Then when I got a little bit older, she came to work here at Columbus Tech teaching nursing. And that afforded her a lot of time off with us at holidays and, spring break and in the summer. And so I just seeing that nursing had a lot of different avenues that you could take, I kind of liked that.
That's perfect. Like coming in her legacy. I love it.
Yeah.
What does a typical day consist of in your field, as both like
in the hospital or here?
Yes.
Perfect. Yeah. So when you work in the hospital, a typical day, you get there about 6:30 in the morning. If you're working on a patient floor, you come in and you take report, find out what's happened, what patients you're going to be assigned to, and what has happened with them in the past, 12 hours or 24 hours, so that you know what kind of care they're going to need. And then you look all that over and you kind of begin to prioritize your care, so that you can see. I'm sorry, my phone keeps dinging. I need to mind my watch. I need to turn that off. I apologize. You kind of prioritize and see who's going to need me the most first, and check in on all your patients. A nurse will do things like give medications. They'll do wound care. They may put in a catheter, they might put a tube down somebody's nose to feed them or to draw content out of the stomach. There's all kinds of things nurses can do, and depending on what kind of a floor or unit that they work on, their day will be really busy, filled with all those kinds of things. So that's kind of a typical day in a hospital. Here at the college, I come in and I make sure that the labs are rolling, that everybody has what they need. If there's students in the lab, and that, restocking everything. And then I spend a good part of my day in advisement, and advisement with students looks different now. I used to advise pretty much all in person and email, but now I do a lot of advisement like this, over a computer screen, sometimes over the telephone, and answering emails. But I spend a good part of my day doing that, and working with students to get them ready to come into our programs, because our nursing program and our degree programs are what we call competitive selection. So the student has to take certain courses, make certain grades, take a specialized test, and earn a certain score on that before they can even apply to come into like nursing or respiratory care or sonography or one of those programs. So I'm kind of like their cheerleader, their coach, to try to help them get all of that done and get it done well and on time so that they can compete. And they, a lot of times they just need some direction with that, because they don't realize how important it is that you do well in your math or you do well in your English class, that it's going to affect whether or not you're able to go on to be a nurse or a surgical tech or whatever it is you choose.
Perfect. So what do you enjoy most about your career?
The thing I've always enjoyed, because a lot of people ask me why I don't work traditionally in nursing anymore. And even my kids used to say, you're not a nurse. And I'm like, yes, I am. I carry a license. Once a nurse, always a nurse. But the thing that I finally really figured out is that I really enjoy relational, relational aspect of it. I enjoy getting to know people, forming relationships. It's very cliche to say I enjoy helping people, but you have to have that in you to want to be in the healthcare field. And so as a nurse with patients at the bedside, I was able to help them. And here I'm able to help people of the next generation become good healthcare, professionals. And there's a lot of, there's a lot of satisfaction in that as well.
Perfect. So what are some challenges that you face in your role?
In my role, I feel like I don't ever have enough hours in the day to do all the different things that are required. And I feel like the floor nurse feels the same way. When I worked as a nurse in the hospital, I always felt that. There's a little bit of never feeling like you can do enough for your patient or for your students. And I feel like that's a challenge. I mean, here at the college, we're pretty fortunate. We get, the college realizes how important our programs are. So we get, a lot of grants and funding to be able to buy the equipment, the supplies, and the things like that we need. So that's not so much a challenge, but just, keeping up with all of it, making sure people are trained on how to use all this high-tech equipment, that kind of thing. Those are kind of my challenges of today.
Perfect. So how do you see your career, and even Columbus Tech evolving in the next 10 years?
My career is going to evolve very soon into retirement, and I'm very excited about that. I'm retiring in less than 4 months. So, but I'm not closing the door on work, because I'm not as old as, I'm old, but I'm not too old to work. But I'm going to take a little time off and then see. But as far as the college, we have had to evolve so much during COVID and learn different ways to do things. And I believe we're just going to continue to do more of that. I don't ever see these primary healthcare professions being able to be taught completely virtually. I think there's always going to have to be a hands-on component with teaching the skills and some of the things that are required. But I do think we're going to see, more of that trend. The need for people in healthcare is great. So I think at our college, we're just going to continue to grow these programs, add programs as they're needed, and, grow the ones that we already have to try to meet the need. One of the things that's really cool in healthcare that people don't think about, and I think this is kind of where the future can go, and especially for people who thought, well, I kind of want to be in healthcare, but I don't really like blood and guts, is there are so many ancillary type careers in healthcare. And I don't just mean your traditional things like working in a pharmacy. Nowadays, there's people that have to create these simulation mannequins. We use AR and VR with the goggles, which is like gaming, but you could do that as a medical person, helping to create that. There's even, because simulation is such a big thing, and the reason simulation is so big is it's getting harder and harder to get into the hospitals and do things with live patients. So we use simulation. There are programs around the country where you can do medical drama and you can act as part of the simulation scenario, like maybe the wife of the patient, or the I don't know, the child of the elderly patient, and they actually take courses in how to be that person. Or they might be the patient and they wear a type of simulation equipment that they actually wear, and then you do things to them through the equipment, but they have to act like that's hurting or that's uncomfortable or that's scary. So that's a whole part of the future in healthcare that some people don't think about. There's a lot more to it than just your traditional in the hospital taking care of a patient. So that's kind of where I see the future going.
Yes, that's so cool.
Yeah, it really is cool.
So what kind of person do you think is most successful in your field?
I think a lot of times people think, let me just back up a minute. When I first was like in middle school, I wanted to be a pediatrician, and I began to think I wasn't smart enough. So that's one of the reasons I abandoned healthcare. I don't think that the smartest people in the world have to be in healthcare. I think they have to be compassionate. That's so important on top of everything is compassion. And then they just have to be willing to work hard, because it is hard work and it is challenging, but the rewards are different from anything that, when you're helping another human, whether you're helping them get better or you're helping them die with dignity or you're helping them in some way with their quality of life, there's no better honor and there's no better satisfaction than comes from that. So I just think that a person wanting to go into healthcare has to have compassion, and then that willingness to work hard. You don't have to be the smartest person in the world. You don't even have to love science or math. You just have to get through some science and math courses till you get into your nursing or respiratory therapy or surge tech or whatever it is. And that was me. I didn't love science or math. I liked English, but I love healthcare and I love the science of the body. So once you can relate it to something, that's more meaningful, it starts to make sense.
That's perfect. So what does communication look like in your field?
Oh, wow. That's changed a lot too, because a lot of it's electronic now. It used to be so much more face to face, but we have the electronic medical record, which is good because lots of people can have access to it at one time. So it does look like that, but communication has to continue to remain personal as well. Communication with the physician or the practitioner, communication with the family, with the patient. And that's something that we deal with a lot with our students, is because younger folks have grown up with this in their hands, and I'm guilty of it too. They have lost or not gained the art of communicating face to face with a human. And you have to be willing to do that in healthcare. You have to be able to touch someone else, look them in the eye, talk to them, give them the answers that they need. And reassure with your voice. You can't always have your head down in a device and do this kind of job. So verbal communication is really important. And I was talking with my 11-year-old grandson about that last night, because the younger people just aren't real good at it. And we've created that environment for them. Everybody's guilty of it. It's not like I'm saying they're bad because they don't communicate. That's just what they're used to. And so sometimes it is a challenge when they come into healthcare to become a little bit more comfortable in their skin, talking to other people and carrying on conversation, communicating with empathy, that sort of thing. But it is important.
Perfect. I love how you've used some of our character words that we've been talking about this year, like empathy, compassion. I love it. So what kind of technology do you use in your field?
Oh, all kinds of technology, all kinds. We just had 2 new simulator mannequins installed yesterday from a company. And these are, when I talk about a simulator mannequin, these are like 50, 60, $70,000 big dolls. I mean, they're human size, but they're very expensive, and they're very advanced. You know, they talk, you know, their eyes blink. You can shine a light in their eyes and the pupil will react. You can put a feeding tube in there, intubate them.
Wow.
Just about anything you can do on a human, you can do on these simulators. So the technology is just so amazing. And over my career, watching it just ramp up, it's really cool. We still use a lot of old school stuff. There's still things that, the stethoscope that we use is still like the stethoscope we used 50 years ago. And that's a vital tool. There's, nothing much more important than that when you're assessing a patient. One of the biggest technologies that we use, which is the simplest, is hand washing. And it doesn't matter how technologically advanced we get. If healthcare workers aren't doing a good job washing their hands, we're all in trouble. I think we've learned a lot about that through COVID, but the technology can be so simple. And, people don't think about hand washing as a technology, but it really is. I mean, it was like an invention in healthcare to learn that you need to wash your hands. So that one is important. And so are we have these new virtual reality goggles that when you put them on, you can look at your patient, and not only are you seeing the outside, but you're seeing the inside, like where the organs are, where the blood's flowing, all of that kind of stuff. And it's fascinating. So the technology is very rapidly progressing in healthcare.
Perfect. So what classes would you recommend for like a middle school or a high school student if they're interested in your career or one similar?
I really love when they get into the health science programs, if their middle school offers them, and especially if their high school does, because it gives you a taste of some of the things that, to see whether or not you're going to like it. Definitely they do need to do some sciences. You don't have to have a lot of in-depth science, but almost always anatomy and physiology, and you have to be able to do some algebra. You don't have to get real intense with math either, like calculus and trig and all of that, but you do have to be able to do algebra, because to calculate medication dosages, you need that. And then, the human science is more like the life sciences. But if they can get into like a healthcare program, it's really helpful. They learn their medical terminology. They begin to learn a lot of the basic skills and learn a lot about the careers, because sometimes we don't think about all the different careers and what they entail. And so those kind of programs really help them to make some decisions.
Perfect. So do you have any advice for our students here at Richards?
Well, I think you're never too young to start. If you have an interest in healthcare, as you're in the next couple of years, you'll be old enough to volunteer in the hospitals, do the summer volunteer programs. Those are great. Try to take your studies seriously. I know that's not always fun. It's not cool, but if you're wanting to advance your career, you need to start thinking about those studies now. It's not like your high school and your middle school grades are going to keep you out of having a career in healthcare, but if you try to really learn the stuff now, it will help so much when you're having to learn a little bit more advanced later.
Yes. Perfect. Well, thank you so much.
All righty. It was great to meet you and great to talk to you today. Thank you.